Hi everyone, my name is Amanda. Thank you for checking out my presentation on my public health rotation this semester. A bit about me, I graduated from the ADN program at Front Range 2 years ago and have been working at Boulder Community Health on the Med-Surg unit ever since. This semester, I completed my public health nursing rotation at St. Anthony Hospital, St. Anthony Central. It is a level 1 trauma center in Lakewood. The hospital is known for its robust trauma services and therefore have an obligation to a commitment to community-based prevention. I was partnered with and had the privilege of working alongside Stephanie Smith-Raby. She is the hospital's injury prevention manager, and Stephanie has a pretty impressive background. This includes serving as a paramedic in Los Angeles, working in the emergency department, then transitioning into public health, and then helping launch multiple level 1 trauma centers across the country. And then now injury prevention manager at St. Anthony's. So her experience definitely brought a unique perspective to the injury prevention focus and field. So throughout my rotation, Stephanie's priority and focus is on identifying and addressing the top 2 mechanisms of injury at St. Anthony. So specifically, those are falls in older adults and motor vehicle collisions. Her work is rooted in data-driven strategies and aligns with Healthy People 2030 goals on emphasizing injury prevention through education, outreach, and community partnership. Her daily routine was pretty fast-paced and centered around trauma system coordination and injury prevention planning. She was frequently in Zoom meetings, in-person meetings, ranging up from organizing a bunch of things, upcoming trauma symposium, coordinating a mock casualty incident drill. She spent time working on the hospital web content for injury prevention. She worked on initiatives and communicating with community partners to arrange educational outreach events. As the injury prevention manager, she plays a pretty critical role in ensuring that the hospital meets the standards required to maintain their designation as a level 1 trauma center. So she has to track injury data, develop educational programs, collaborate with multidisciplinary teams, and facilitate community engagement efforts, and then track her data and outcomes and submit that for them to maintain their level 1 trauma designation. So the injury prevention manager is pretty essential to both the internal planning of the hospital and the external outreach. So her top priorities included reducing high-risk injuries, particularly falls in older adults and motor vehicle collisions, because they are required to address those top 2 mechanisms of injury, and maintaining compliance with trauma center accreditation standards. So this meant focusing on evidence-based prevention strategies, planning large-scale educational efforts, and continuously evaluating those the outreach effectiveness. The injury prevention manager serves as both a clinical and community leader. So the 3 objectives that I identified for myself this semester was to identify 3 evidence-based fall prevention strategies used in the older adult population and assist in an educational initiative related to fall risk reduction, to analyze trauma data related to motor vehicle collisions, and contribute to a plan or deliver 1 injury prevention campaign to improving safe driving behaviors, and also to attend or shadow at least 1 disaster preparedness activity and reflect on that. So I was able to attend a disaster preparedness activity. It was a tabletop where people came in from, I'm not exactly sure what team they're with, but they are with Common Spirit, who St. Anthony Central is a part of, and they basically go around and talk to staff in different hospitals about scenarios of different disaster preparedness, and this one was focused on an active shooter scenario within the hospital. And it was kind of eye-opening as it shifted the conversation from traditional mass casualty incidences to a mass casualty incident response, internal emergency response. So considering the challenges such as protecting hospital staff, maintaining operations, rapidly communicating with the departments. So I got to see everyone's thoughts on that and maybe where they were lacking and where they could improve, and be prepared in case that ever did happen. As far as motor vehicle collisions, Stephanie's outreach is aimed at teenagers. She visits the local high schools, and because it is summer, she was not able to do that. I was able to review her campaign for safe driving, which was called Choose Safe, and it was a program to encourage young people to advocate for safe driving habits, both for themselves and their peers, but also speaking up when they feel like adults are driving unsafely, because interestingly enough, it's not teens who contribute to most of the motor vehicle accidents in their area, it's adults. So people over the age of 30, I believe it was. So it really is, it's aimed at teens, but it was cool to see that while aimed at teens, it was also trying to address that adult population through them. So for falls, I did identify 3 evidence-based prevention strategies. One was home safety modifications such as grab bars, improved lighting, removing throw rugs, stuff like that. Strength and balance training was the second one. Programs like Tai Chi have been shown to really increase strength and balance and reduce falls in older adults. And then medication review, so reduce polypharmacy-related fall risks by reviewing medications. So I did come up with a education initiative for fall risks, which I will talk about a little more here. So the group that I identified for my initiative is adults over the age of 65 are identified as high risk for falls, and key focus for this population was based on both local and national trends. So in Jefferson County, there is 172 deaths due to falls over a 4-year period, and all but 3 of those were adults age 65 and older. So it's important to note that these are deaths in the county only. They really don't capture a much larger number of non-fatal fall-related injuries that result in hospitalization, long-term disability, or loss of independence for these older adults. The CDC reports that falls are the leading cause of both fatal and non-fatal injuries in older adults. In fact, 1 in 4 adults age 65 and older report falling each year, according to the CDC. So these are pretty alarming statistics and highlight the urgency of identifying and supporting older adults at risk, especially in communities like Jefferson County, where the aging population continues to grow. So my fall prevention initiative is a multifaceted plan that, a multifaceted discharge plan for older adults that are identified as moderate risk score for falling. And my thought process behind finding these moderate fall risk is that people who are at high risk are going to be discharged to rehab or with other resources to get them hopefully to a moderate or lower risk of falling. But the people who are at moderate risk for falling, my idea is to catch these people and improve their balance before a fall occurs. So my proposal centers around having physical therapy staff assess these patients being discharged home using a tool that Stephanie already uses in her outreach programs, which is the Zebrio Stability Scale. You stand on this scale, and it is a tool that measures your fall risk based on balance by measuring your micro movements. And Stephanie also already has a packet about what the moderate score means, and that would be included with this score that these people are given. So PT would evaluate them. Each patient would receive a personalized packet, including their fall risk score and explanation, physical therapy approved balance exercises, as well as a brochure inviting them to attend a Tai Chi class that Stephanie has had trouble creating interest in. So she already has this class that she teaches, but has had trouble gaining interest in it. So I thought it would be a great way to engage people who need it. And it's also an evidence-based intervention proven to improve balance and reduce fall rates. The packet would also include a flyer from the fire department, which Stephanie already has, and it is the fire department's volunteers to go into the home and do a free home safety assessment and short-term post-discharge support. So if a patient wasn't able to pick up their medications after discharge, they would offer that short-term support, keeping them out of the hospital and safe, hopefully. So, as well as the volunteers would, do small things like install grab bars or things like that for the patient if they identified that as a need. Additionally, the materials would contain a simple self-assessment, tips in identifying environmental hazards like poor lighting, loose rugs, clutter in the home, so factors that show to significantly contribute to fall injuries. So this plan kind of reflects a holistic and accessible approach that combines early risk identification, evidence-based exercises, and home hazard reduction. An integrated model identified by the CDC that is widely supported in fall prevention literature. Sorry guys, having a little bit of technical difficulties, bear with me. As far as measuring my outcomes, I would track how many packets are being distributed, how many patients are following through with referrals to the fire department, and participant rates in the Tai Chi program. So monitoring these data points will help determine whether the intervention is increasing awareness and helping people access support to these services and ultimately reducing fall risks. So this approach follows evidence-based best practice for evaluating public health programs through these measurable outcomes. So as far as measuring the effectiveness of my program and implementing my program within the time frame that I was there, there were some barriers. All of the materials have to go through their marketing program and basically be branded by Common Spirit before they were distributed. Stephanie had to contact physical therapy to see if they would be willing to use the Zebrio scale and hand out these packets. So although it seems like Stephanie was interested in this, I was not able to actually implement the program in the time frame that I was there. But as far as evidence-based justification, Tai Chi reduces fall risks. Some RTCs show that Tai Chi reduces fall risks by up to 55%, and that home modifications reduce falls by 26%. So the thought behind this is that structured exercise and home safety equals fewer fall-related hospitalizations. So with my plan not being able to be fully implemented, I wasn't really able to get group feedback on how this worked, but to kind of ensure stability and assess the long-term effectiveness of my fall prevention initiative, I propose a follow-up plan that can be implemented by a future public health nursing student. So the student can evaluate multiple things, including whether the distribution of the balance assessment packets was successfully integrated into the discharge process. They can meet with physical therapy and gather feedback on the practicality and impact of using the Zebrio scale and distributing those educational packets. And additionally, they can review participation in the Tai Chi program and see if the participants saw improvements on balance and confidence, and then kind of finally follow up with the fire department and determine if they've seen an increase in home safety referrals from the kind of stemming from the brochure distribution. So as far as learning summaries and learning outcomes for this semester or this class, then I definitely gained a broader understanding of population health. I gained insight on how it extends beyond the bedside, being I am in bedside nursing, so that's majority of my experience, involving community systems, data trends, and long-term prevention goals. So an example is understanding how trauma data from the hospital informs prevention initiatives like fall risk reduction and safe driving campaigns. Another thing that I learned or found when I was doing kind of research throughout the semester, that it's kind of hard to prove public health nursing interventions are effective. And I believe that there's a few reasons why. One is long time frames. Many interventions like fall preventions take months or years to show results. There's so many variables, it's hard to isolate one program's impact on the factors and what influences outcomes. And as we've learned this semester, there's just multiple variables and factors that influence that. Also, the public health aims to reduce risk before problems occur, which can be less visible. How do you measure a fall that didn't happen? So just kind of things on that. One of my biggest takeaways, though, from this semester is learning that success sometimes does look like prevention. So, like I said, the fall that didn't happen and a life that wasn't lost. So, a community that became more resilient because of it. I learned a lot this semester, and these are my major takeaways. I hope you guys enjoyed the video, and let me know what you guys think. Thank you.